I'd like to thank all the speakers of the session as well as the chair. We now move on to the panel discussion on building a national framework for healthy aging. I'd like to introduce the moderator, um, Professor Prabhdeep Kaur, a longevity investigator and also the chair at the IISc Center for Public Health at IISc, Bangalore.
Just begin with the introductions. So I think this is a perfect timing for this panel because 2 days you heard a lot of science and you heard industry, and morning you heard the epidemiological data, and now it's time to talk about the policy. So I'm very happy to invite our panelists. First of all, Commander Amit Rastogi, Mr. Rajeev Sadanandan, and Dr. Abhishek Kunwar. May I request you to come to the dais? So thank you very much for joining us. We have three eminent panelists today with extensive experience in public health programs, industry, and policy. So let me begin with the brief introductions. So we have Commander Amit Rastogi, who is the Chairman and Managing Director of National Research Development Corporation. He has had an illustrious career in Indian Navy for 34 years before joining this current position. He has worked across frontline warships, naval dockyard, Directorate General Quality Assurance, and so on. He has been responsible for induction of state-of-art technology-intensive systems through indigenous development and transfer of technology route. I'm also happy to welcome Mr. Rajeev Sadanandan, who was the Health Secretary for Kerala and has played a very important role in formulating very important health policies in Kerala, which then became a sort of model for many other states and also in all over India. He was CEO of India's National Social Insurance Program just before all these PMJ and all came. So maybe he can tell a little more about that. And in addition to that, he has held several important positions in UNAIDS, WHO. He was also involved in developing the Pandemic Preparedness Roadmap 23-27 for CRO region. He has contributed to many programs and was also there for during COVID, Nipah outbreak, and you heard the very good handling of Nipah outbreak. So Nipah never went out of Kerala. And all those great things he has done. I think he's perfect to share with us what we should be doing around aging policies from a governmental perspective. And we have with us Dr. Abhishek, who is a physician, and he's the National Professional Officer for NCDs at WHO India. He provides the strategic and technical support for NCD prevention and management, working closely with Ministry of Health and Family Welfare, and he has been working with the India's NCD program, where we need to actually put a lot of these policies related to healthy aging, because we would like to do prevention rather than treat all those diseases. So I think we have, the stage is set by our speakers from Lasi and Isha, and as you heard that we have huge burden of chronic disease, and it is beginning in the middle age and then going into the older age. And for last 2 days, we've been hearing about healthy aging. So the healthy aging has to begin early. That's the most important thing. And so to discuss today, we will be looking at the policy frameworks. What frameworks do we already have? What are the gaps, and what possibly we can do to have a better plan of action going forward? So let me begin with Dr. Abhishek. I think you have a mic here. So we know that WHO has come up with the WHO Decade of Action Plan, so which focuses on healthy aging. Can you tell us a little more about this action plan? What are the key pillars of this plan? And then maybe in context of our NCD program, how we should be including some of the policies which are relevant to healthy aging. Over to you, Doctor.
Thank you, Dr. Prabhdeep, and thank you for inviting me for this session. There was a UN resolution for UN Decade for Healthy Aging 2021-2030, which has came as part of UN resolution for better life for the elderly population. So all the UN organizations have come together for this decade of healthy aging, and WHO has been asked to lead this decade of healthy aging resolution, where WHO is also working with the the healthy, there is a collaborative for healthy aging collaborative, where governments, international partners, media, academia, experts are collaborating and giving their comments on in this area of the decade for healthy aging. So coming to the action points for the decade action points. So there are four decade action points. So first is the age-friendly environment, and this is very important in terms of the age-friendly environment for a better workplace, for better work, better play, and your lively all the daily the for the better daily life. So WHO is working with the different member states for developing and generating the evidence for the age-friendly environment, and there is a global network for the age-friendly environment, where in India, Kochi, Kerala is part of that global age-friendly environment network. So they are working together with the Kochi. And second is the action point is combating ageism. And I just heard one of the questions with regard to the some abuse of the elderly. So yes, this is the area. There are a couple of points in terms of this, like how we act, how we react, and how we feel. So how we act, irrespective of all the age groups. So these are the three broad areas in the combating ageism. WHO is working with the several member states to develop some of the resource materials, to develop some of the evidences where the how we act, how we react, and how we feel can be put together, and all countries can benefit from that. One of the very important action point is the integrated care for elderly. Mostly it surrounds around the elderly population. So integrated care in terms of the bring so there will be multiple like terms of NCDs, there will be multiple diseases, multiple risk factors, multiple areas need to, it is a comprehensive integrated care if we can say in terms in a way it can be. So it should be a patient centered in integrated care, where the there is ICOP, the integrated care for population living with elderly. There are three implementing areas. Just to wrap up with this, there are three implementing areas. One is the micro, where the patient-centered care. Second is the meso level, where the service delivery. And third is the macro, where is the governance and accountability lies. So WHO is in this area also working with the member states for developing this micro, meso, and macro level of guidelines and the framework with different member states. And the most and the last important point is the long-term care for elderly population. So, and where the NCDs will come, where the because we have seen the Lassie study, which I always quote. It is one of the best studies for the in terms of the NCDs. There are in terms of the prevalence and other things. So if you see the long term care, so this have a four pillars. One is the essential health services. So to get essential health services, second is the workforce development for the elderly care. Third is the family community level of some support which we need to develop. And third and the final is the fourth part is the sustainability and the financing, where the Pradhan Mantri PMJ will be play a very critical role in terms of the long term care. So these are the four pillars, decade, four action points which WHO is working together. But in terms of NCDs, I can talk maybe now or later also about how the NCDs were the risk factors for the NCDs, and preventing NCDs for the elderly population can help them in the long life with not long life with a healthy life. So I may talk later. Okay. Thank you very much. Thank you.
Thank you, Abhishek. I think you have really set the framework. So I think, as you heard, there are these pillars which have already been sort of outlined, and then now we actually need policies and programs which fit into these frameworks. So let me move to Mr. Rajeev. I hope you have a mic there. Yeah. Okay. Great. So you were health secretary, and I think you have seen the aging population increasing in Kerala, the life expectancy increased, the chronic disease burden increased over time. And so you have actually seen the transition from what we call as the epidemiological transition, right? When we all worried about infectious disease and the causes of death related to maternal child health. And I think in your tenure, you shifted to seeing more of NCDs, right? So how this shift has translated into our mindset when it comes to policies and programs. So would you like to share your experience, and where do you think we sort of got it right, or where do you think there are gaps which we can fill? And little bit reflection on, because you have closely worked with the insurance program. So as you know that we we go on treating more and more sick people, but ideally we should be increasing the healthy lifespan. So your reflection on that, are we investing enough there, or are the insurance program actually treating sick but not thinking enough about how to invest in building a healthy population? Over to you.
Thank you, Prabhdeep. Uh, on the policy dimension, I'll distinguish between the aged, that is the people who are already aged, and the topic of this speech, which is this panel, which is healthy aging. These are two different areas. If you look at, in fact, a couple of years ago, I wrote a paper on the policy environment of aging, and what we found was that very little policy clarity was there on aging part, and that was immediately after the Lassie. So after Lassie, maybe things have changed. When you talk about policy, there are three components that we talk about. One is the problematization, understanding and accepting that there's a problem. Second one is a policy in which researchers generate methods on what to do about it, and which is what this whole conference has been about for the last 2 days, where it was impressive to see the kind of studies that are going on, and that by itself is extremely valuable. But the most important part of a policy mixing is the political stream, in which the political decision is taken. So policy changes happen only when all these three streams come together. First of all, the problem has to be recognized. Secondly, the solutions have to be there. And three, there has to be a political will for people to move towards it. Now, I'll leave it to you to see which of these are in place. Let me come to the problematization part of it. This is something that is hardly recognized. In fact, you asked me about what I did as health secretary. I've been accused of not doing enough for the aging part. But so while we do not find a clear formulation of healthy aging, there are determinants of aging on which the policies are needed and can be analyzed. Now, the formula for healthy aging, as all of you know, is very simple: healthy living. Now, so then, what are the components that we need to look at? One, on the most important thing, which I think Abhishek will also mention later, is kick tobacco. And sorry, guys, no amount of alcohol is found to be healthy, so that again is something that needs to be got rid of. There are policies on it, and actually, some states have succeeded in reducing the consumption of tobacco and I think and my state is one of them that actually reduced the consumption of tobacco. So it is demonstrated that is possible. Second one is, of course, the alcohol part, in which my state has failed miserably, which I suppose applies to the rest of India also, hopefully not. The third area, of course, is diet, and it doesn't happen by itself. Because when we look at it, we find that most people have less than 1/5 of the recommended dose of vegetables, and no amount of talking about it is going to happen. So what we are now doing, at least in the area that I'm now working with, what we're trying to do is to create conditions around which vegetable availability goes up in the village and encouraging consumption. Another important area which has to be part of a framework for healthy aging is physical activity. Our experience shows that unless physical activity is imbibed at an early stage, physical activity becomes part of education, it doesn't work. The National Education Policy talks about the incorporating sports into curriculum. I hope that succeeds. The right to education hardly mentions the physical activity at all. So encouraging physical activity, ensuring that people do it is the other part. Now, for the post-school children, what we are now finding when we work with our population groups is, in a village, where do people exercise? Where are the playgrounds? How do you teach them what is appropriate to exercise? That again is something that on which we need to have activity going on here. And in urban areas, we ask people to walk. In fact, that is dangerous for health in the urban cities. The space, the pedestrian, the cycling pathways, they don't access parks. Interestingly, when I travel to some of the cities, I find that is now catching up, and hopefully that will encourage the other big problem. You mentioned about health insurance. The other problem is that we don't plan for at a time when our expenditure will go up and our income will come down, and that planning is something that has to be encouraged as part of this of the framework that we need to. India gives the IGNOPS, the Indira Gandhi Old Age Pension Scheme. I hope it's still called Indira Gandhi IGNOPS, but very, very minuscule. And except for the formal sector, this is an area which we don't have. And the other to healthy aging is having proper medical attention at that point of time. I'll come back to the 70-year-old PMJY. As a former insurance person and as a former head of RSBY, I'm highly skeptical, but I don't want to go through it right now. Not because of the intention, but because of various areas. We'll come to that if you have time. I guess Abhishek is going to cover NCDs, so I won't touch them now. But the major problem going forward is going to be falls. As a senior citizen who's my biggest fear is are falls now. But there are now exercise available. We are trying to train people on how to avoid falls by actually working on it. But that is not enough. I have fallen 3 times in Indian cities, not because of my lack of attention, but because the roads are so bad that in the night I didn't see them and I fell down. So, and then your bathrooms, the area where aged people are going to fall down the most are going to be bathrooms, because the oil that we use and the smooth surfaces that we have. And finally, this question of adult vaccination. It is a possibility that we haven't explored, and there are studies going on. Hopefully, that will happen forward. And again, preparing for dementia. Mental health is dementia, as I think you'll hear later, will be a major problem that we will face in the future, and we're not prepared for. It's not as if nothing can be done. We need to have preparations for supporting prevention of dementia. Finally, it's not as if all the aged are Bechara, they need help. They are an extremely productive resource. As Professor Shekhar mentioned, a lot of people aged above 70 still work. That's not a compulsion. Do you have a policy in which is it possible to persuade, create a condition under which it's possible to bring people to make them productive? One of the things we are trying to do is in my village is trying to see if the aged can be brought into primary schools so they can tell stories, they can work with them, and that can be taken. And finally, I hope I've not run out of time. I mean, I have. Yeah. Finally, the biggest problem that was identified in a survey that some of my associates had done in my state of the age is not ill health, not dementia, it is loneliness. It is socialization. So creating structures that make it possible for elderly to come together would be the other major area in which possibly we can help healthy aging. Thank you.
That was excellent. I think give him a big hand. He has really laid the ground for all the policies we need in India. I think very, very deep insight coming from someone who has really spent his lifetime on the ground. And by the way, we were talking yesterday, so if any of you want to do Medicine 4.0, please go to his village, because that's what he's doing now. So he told me that all through my career, I didn't have the time, that now I'm going to implement all the policies I was part of making. So, including the ones which are yet to be made. So, please do join hands with him, and anything you want to implement to promote healthy aging, I'm sure Rajeev sir will be very happy to support you on that. So, now we'll move to the really important theme. And Commander Rastogi, you know, we have heard for last 2.5 days so much about technologies. And especially many of us don't come from technology background. And even as doctor, it's hard for me to say which of these technologies should be used or not used. So I really wonder how community will figure out, how will they know, is it good for me, is it bad for me? And as you know, you are part of the National Research Development Corporation, I want to understand how you are viewing this whole innovation landscape in the space of healthy aging. I mean, we definitely know that technology can be an enabler, but then how do we find that right balance where we use the technologies which are scientifically proven, valid, and at the same time ensure that we are not pushing technologies which may not be useful or may not be scientific? Over to you.
Thank you so much, Prabhdeep. And I would like to thank Dr. Deepak for inviting me here. And thanks to Dr. Vishal, who is there in the audience, for triggering this participation of NRDC in this event, what is happening here. And all of you, I think, with the introduction, what you've heard, must be wondering as to what is this person going to contribute to this. Bit of disclaimer, I never appeared in my biology exam in 12th. I'm a non-biologist. And being a naval veteran, and with the kind of the introduction what I was just conveyed to you, I have a difficult task to convey to this audience, which is full of intellectuals and primarily in the domain, which is, for me, it was, exercise in education, which happened over a period of the last 2 days. But I think the present credentials of mine, of being in National Research Development Corporation, puts me in a place wherein I can certainly talk about technology development and technology commercialization. So that is one space which I found was sort of not addressed in the talks what we had, though there were quite a bit of talk about digital interventions and AI-based the solutions which were talked about. But majorly, the technology development per se for the topic what we are talking about as healthy aging was not discussed. So before I think dwell on it, I think it is important, whichever forum I go, I need to expand this mnemonic of NRDC, the National Research Development Corporation. So to set the context right as to what NRDC does, and whatever I speak will become slightly relevant. So NRDC is primarily a 70-year-old government PSU under Ministry of Science and Technology. And we come under Department of Scientific Industrial Research, primarily for, created for technology commercialization. So very, very unique thing to happen, mainly because this was conceptualized when the CSIR labs, 37 of them were brought into action primarily for doing research and development activity in the country. But for the scientists to take the technology to the market was not a viable media. So an organization like NRDC was created to do technology translation and then do the hand-holding for technology commercialization. So that, it means if it has been lasting for 70 years, it means that activity is still relevant. But we are operating in a kind of ecosystem in which there is a requirement basically to repurpose yourself and to take care of this land space, I would say, the white space of technology development through the involvement of the work which is happening in our higher education institutes, public funded research institutes, and also through the startups and MSMEs. So what we find is, and I think what you were asking about is there anything very specific to healthy aging related technologies? I would say the way we deal with them, not necessarily, but presently to this audience where everyone is primarily involved in why are we doing all this study is primarily based on that study. We will do a gap analysis So it means you're looking at certain solutions. So it means from the discussions, what I think what I have heard, what we are looking at for healthy aging is the socio-scientific solutions. So we did talk about social interventions and the scientific interventions as well. The scientific interventions will certainly result into a product or a process. And the product and the process should not remain in the lab. It is something which should reach the market. And that effort of taking it to the market, whose responsibility would be. So what I find is that when you generally remain in the domain of research and development, the focus is not primarily on taking the technology to the market. You are intrigued by one particular issue, you work on it, and then when it matures, you think that as to are there any takers for it. So you are looking at a push mechanism. And I would say because of this push mechanism, when the customer is not consulted or ready, or industry is not consulted or ready primarily to take the work what you have done, that's where the issue comes about that the technology does not reach the market. So in the concept, so I may not be relating it to healthy aging, but the concepts are the same there. So whatever, so it means during the process of technology development, it is incumbent, I wouldn't say on the researchers per se, but the mentors who are there, they need to possibly look at what could be the possible application of it. Technology development, which I'm doing, obviously has to be with some objective in sight. If the objective is primarily to engage startup, MSME or industry at a later point of time, should that engagement happen early? So I think all of you would have heard something called the TRL assessment, Technology Readiness Level Assessments, which we normally do during the process of technology development. So that is the concept which generally doesn't get applied to. We are primarily happy the way we are in our academic institutions and also in public funded research institutes somewhat better, where the funding support is also available. We are happy with the proof of concept. But the proof of concept is not good enough for the technology to get translated and to be taken by the industry. So there is a further technology development process which is needed. So what my, I think, advice, and especially from the policy perspective when you're looking at, is that one is to look at the technology development part of it holistically during your research and development phase. And there are very many nuances to technology development. So I think it is a niche area. There is a requirement primarily, if the need be, a consultant may be taken primarily to help you with the process of technology development. And and especially during technology development, there are lots of things I think which one needs to possibly look at. I'll just name a few of them, like raw material selection. Even the technology what you have used primarily to build your particular product. So it means, have you done a technology scanning to see as to what are contemporary technology which are available in the market, and am I using that in my the product or service which I'm building it up. So once that is ready, then I'm looking at the technology commercialization part of it. So technology commercialization, obviously we're talking about TRL 8 or TRL 9. That is, I would say, again, a very, very specific area for, I wouldn't say for not the scientists to indulge in. I would say there is a unique, it's an aberration in point that I will quote an example of Dr. Vishal Rao himself, that he is a practicing surgeon, at the same time a biomedical engineer. So who has been working by the day in the hospital, in the night in his lab, and as a result of which he has come out with a solution and which needed to be scaled up. So that's where the intervention of NRDC came in, because we have lots of promotional schemes of Government of India. So I just want to basically make this audience know that there are programs, there are schemes which are available, through which the support possibly can be provided financially and also otherwise for technology development and commercialization. Thank you.
That was very helpful. I think there are many entrepreneurs here. I'm sure you please reach out for guidance. And just to want to also highlight that ICMR started a program called MedTech Mitra some time ago. It's actually doing well. They are really working with the innovators to see that how to cross those hurdles to take, from a prototype to product. But I think one thing well said, and I want to reiterate that, please do need assessment. So since we are hearing, we have been hearing a lot about technologies for last 2 days, and I wonder how many of these will really be taken up. So that's worrisome sometimes. So we don't want, our young innovators to get disappointed. So I think good to do some research, understand the needs before you move on to actually sort of taking technology. And then there are quite a few instances, and if you can add on, when you were a health secretary, you might have had situation people coming and telling you, we have this technology, will you take it? So if you can tell the people out here, how do you make those decisions? Because it will help our young innovators, especially working in this space of wellness, healthy aging, and so on.
I have a lot of sympathy for Commodore Rastogi because, for innovations to get absorbed in private sector, you need volume. It doesn't work. In government, you need the L1 procurement, which makes it very difficult. Okay. The problem with asking old people to speak is they'll tell you stories. Now I have to tell you a story. Okay. There was this researcher from Stanford, brilliant boy, who had come up with a material. He landed in India and he met me and he said, look, the material that we have can prevent hypothermia of children. If so that's a wonderful material. I said, come on here, we don't need it. We have our deliveries happen in hospitals. Go to some other states in him. Sir, I went there. They didn't want it. Can you buy it? So we bought this thing. But the problem is that the current procurement systems don't allow that. And since I've been stupid, I took those decisions. But the boy was smart. What he did was that he went and showed everybody, look, Kerala has bought it. How can you not buy it? And it went on to become a success. So that's a one-off thing. How it can be figured out, frankly, I have no idea. And the other problem is also that in my career, I've seen so many state-of-the-art solutions that said, this is a wonder thing that you can do, and I've seen it disappear from the scene in no time. So over time, sorry, Dr. Huja, you develop a lot of skepticism to new suggestions that come till it gets proven on the ground. So it's a catch-22 situation. How do you prove it unless somebody trusts it? And how do people like me take it when it is not proved? So it's a catch-22 situation, which I'm very happy to leave to Commodore Rastogi to figure out.
So do you want to add on to what he said? Because it's really important for innovators to...
Yeah, this is something actually which I noticed even we've been listening about AI-based intervention and AI-based apps, which everyone talked about. I think especially in the medical space, even for the drug formulations, I think we have phase 1, phase 2, and phase 3 trials, which one has to go through that route, and then there are approvals of CDSCOs which needs to be taken. But what is it primarily for, the app-based solutions which are coming about? As of now, I think it is unregulated. And for the customer to have a confidence or the patient to have a confidence in it, merely stating of claims by one individual by testing on maybe few hundred individuals, will that be right? So though as of now it is unregulated, there are no regulations to this effect. So, but I think it is important for the customer confidence to build up, for this to get into the regulated space.
Thank you. I think that was a very important point. Just coming back to you, Abhishek, like you've been involved with the NCD program. So I was wondering that a lot of policies which we sort of was outlining, how do you think the implementation is on the ground in terms of either it is screening or policies related to promoting lifestyle modification and so on? And where do you think are the gaps? Because if there are innovators who want to develop new solutions, whether devices or whether it is AI tools, so where is it you think they can contribute?
Thank you. Just to at one of the NCD, the Good Practices Conference, one of the Secretary of the State told that the state is using more than 80 apps. So it is just I'm quoting from, I will not name, sorry, sitting here. So, but it's not easy. It's a difficult situation because a lot of apps may have different challenges also. But there are good apps also. So how to bring it together? It's a one thing which can be discussed later. But what Dr. Prabhdeep has mentioned about that, the NCD, you see under the NCD division, there are multiple NCD programs. One was mentioned about the elderly care program is already there. There is a NPNCD program, National Program for Prevention and Control of NCDs. There is a mental health program. There is a palliative care program, and there is a tobacco control program, as sir mentioned. And there are many, a couple of other programs. And I will say that it is not that how program is going on. It is going on good or not. But there are programs which can be, which the the other areas can be built on that. For example, I can give you, there are gaps and challenges, and which is very debatable and needs to be discussed at the all levels. But I can give you one example. If you control hypertension, you prevent dementia, you prevent heart attacks, you prevent stroke, and for diabetes the same. So controlling hypertension, you prevent lot of other diseases. Second, lot of other diseases which can be fatal. So there will be two levels of prevention. One is a primary prevention, where sir has mentioned about the risk factors. So and other will be the secondary prevention when you control hypertension, diabetes, and then which can lead to the very other diseases. So for I can give you one example very quickly, if Dr. Prabhdeep allows, from hypertension control program where Dr. Prabhdeep and sir was a person who started in the Kerala. So I think the government of India initiated hypertension control initiative program with the multiple states, and the results were very encouraging because it was a very meticulously planned. It was an outcome-oriented program where the more than 5 million populations were put on treatment, and more than 50% was at end of the 4 years, 50% was under control. So you are saving these 50% from dementia, from heart attacks, from strokes, from other disabilities, other diseases. So this building on the existing programs, there there are you can we can always work towards the existing system to build on the other programs. And last point I will mention the challenges. Challenges. Rajeev sir is here. We know all that. What are the challenges? Challenges starts from the policy level till the implementation level. So it has to be seen in the different ways. So what is the policy level challenges? What is the implementation level challenges? And there has to be, in this also, I will mention about there has to be indicator. So there has to be progress indicator and outcome indicator. If we don't define the indicators in terms of the implementation, maybe progress or outcome, the results will be very varied and we cannot be able to come to the outcome. And again, coming back to this, all these areas are aligned to the UN Decade Healthy Aging Goal, which is the 4 pillars, the age-friendly environment, the ageism, then combating ageism, then integrated care and long-term care. You can think on these areas, you will find that whatever work you are doing in different areas will fit into this, and let us work together for a same goal. Thank you.
We will take a couple of questions. Our panel has been very, I think, crisp. So we have about 8 minutes for questions. I know there are a lot of questions. So we will take, so let's start from the middle. Can you bring the mic there? And somebody bring the mic here so that we can parallelly, yeah. Okay, please go ahead. Keep your question brief and don't give like a story. Make it very crisp so they have time to answer it. Yeah.
Good afternoon, sir. My question.
Only they can tell story, not the people who are asking questions. Okay.
Good afternoon. I'm a postgraduate in preventive and social medicine. My question would be to Rajiv, sir. Since Kochi has become one of the first age-friendly city in the Southeast Asia, can I know if there's any specific age-friendly checklist? Since WHO already has a checklist, is there something that which you have implemented with respect to an Indian aspect? And also, it's difficult to generalize it in urban and rural area. So has there been any specific questionnaire or a checklist that has been developed, and any small gist of how it...
I'm afraid that this happened after I left, so I won't be able to respond to that. But we have Matthew here who was around that time. Catch him during lunchtime. Matthew, can you put up your hand, please? Yeah, catch him during lunchtime to explain that. Yeah.
So Matthew, Dr. Matthew, you're on spot. Please catch him, and he's in the panel later on. So he will be talking about that. The checklist is available. Abhishek says that. So I think it's online. There's a question here. Go ahead.
Yeah, hi. So I have a quick question. Access to the elderly. We covered a lot of points on elderly policies, but access to healthcare, physical access, I mean, not financial. Are there policies on that? Is healthcare going to the elderly, or can it make it more easy for them to come to a healthcare center?
Are you talking about physical access or financial access?
Physical access.
Physical access, yes. There is a policy, and I've seen it across India of people making age-friendly, disability-friendly situations. That is slowly but surely happening, and that recognition is already happening. And also there are policies that many states have implemented, which is that age people get a preference in terms of having separate queues, priority over appointment, and so on. So that is slowly coming up. Health is one area where you can't ignore age. It stares you in the face. So some things are already happening. Yeah.
Thank you.
Hello.
And there's a question at the back. I think then
Yeah.
if you have a question, if you can stand up, it's easy.
Yeah, I'm here. You are right.
Please go ahead. Who is talking now? Okay, you go ahead and then yourself, sir. Yeah, okay.
Thank you. So, thanks for bringing out that ageism related thing. See, the question is about the longevity. In India, how many elders are really willing to live longer life?
Very interesting question.
Because see, longevity itself, there are a lot of studies going on whether the longevity is the real need, as what Amit was asking, right? When they don't have enough finance to handle their own thing, even as Mr. Rajeev mentioned, the pension schemes, how much they are providing, 800 rupees, right, for one whole month. And even the insurance schemes, ABM, one elderly, there is a news in Kidwai that an elderly committed suicide because he did not get the insurance covered because he has the card, ABM card with him, but the insurance is not covered. So, yeah, is there a real need for longevity in India, at least?
Okay, so before they answer, since I'm a chronic disease researcher, let me answer this. Others can add on. I think when we talk about longevity, I don't know if you heard some of the talks for last 2 days. What we are trying to say is that life expectancy has increased because we controlled infectious disease. But can we make sure that those extra years which we got, people are actually having good quality of life and they are not spending those years being diseased? So I think that's the context here. Of course, there are California billionaires funding longevity research. So longevity research will be there, whether you like it or not. So I will let others add on. You want to add on to this?
Well, I've been chosen because I'm the closest to the area that you're talking about. Do you want to live longer or not? Now, it's a question of, one good thing that was there in this conference was the focus on health span as against age span and on sick span. So that was, I think, a very important distinction that came out. Now, don't we owe it to our people to ensure that they are able to add health to their years or life to their years than years to their life? So the point you're making is that merely focusing on the age span or adding years is not what we should be doing. What we should actually be doing is to ensure that whatever time they live is lived in an enjoyable manner. So I think that is where the policy should be. Look, are we willing to terminate our life just like that? What do you think others would be willing to? Help them make it, but I don't think, again, at this stage of life, I don't think anybody wants to die on their own. Those who want might commit suicide, but otherwise, everybody would like to continue their lifespan, provided we make it a happy lifespan. And I think that is what our policy should be focusing on, not on longevity, on age span, but on a healthy lifespan.
Yeah, excellent. We'll take one last question.
Here.
Yes. Please meet the panelist in the break. I think you can, you were actually, you yourself and two, I'm going to stop with that. Yes.
Hi, my name is Avinash. I've been here, this is the third day. I've been wondering why there is not much discussion around the influence of over-intelligence in digital devices and how it impacts lifespan. I'm speaking about kids who are being fed by their mothers with their smartphones on, and how it impacts their lifespan, the quality of life. The social media influence, all these negative influences of overintelligence in digital.
Yeah.
Any policy thought on that?
Okay, I will take that question so we can answer it together. Sure. Yeah.
Abhishek, as you mentioned about ageism in India, or actually it is across the world. So still we see there is a lot of discrimination against elderly who are mentally fit and in a physically fit, but they don't have a equal job opportunity. They are forced to retire.
Okay.
So doesn't it affect the quality of life in a negative way of elderlies?
Okay, one point I will make is that one of our, colleagues here who will be in the panel in the afternoon actually works in this area. Neeraj, right there, please raise your hand. Maybe you should connect with him, but any panelists want to answer any of the two questions quickly? Because we have
About
to wrap
your
up.
question, the screen time, the Niti Aayog is coming with there is a school health program which is coming up, where the screen time is one of the major thing which is be covered in that. So, and there is a NCD in children is also the policy which Government of India is coming with. And there is third is the multi-sectoral approach for NCDs. So under the school health program, so this will be covered. So I think the lot of talks are being done in this regard for screen time. This is one of the major issues, not for the kids only, it's for the all age groups. We can see ourselves also how much time we take for the screen time we take.
Thank you.
So this discussion is going on, and surely this will come up maybe in the near future. Thank you for this.
I think employment among elderly, actually, Mr. Rajeev already mentioned that it should be encouraged. Do you want to add one last point? We have to wind up.
No, there is a problem. Remember, the young people are also waiting for the jobs, and for people to continue in formal employment will create too much of a resistance. So what we suggest is that for people who do not create voluntary opportunities for people to contribute, and I think that is something that a lot of people would be willing to contribute. My problem is that we do not create spaces for them to contribute. That's one more small thing that I missed out. Something that we recommend should be part of the primary health care is that while NCDs are important, we also need to bring in looking for the downstream complications of NCDs. That is, a person who's been diabetic for so long, he's likely to have conditions that will lead to aging. This thing, and I think a policy change that need to happen is looking at end organ damage that happens out of NCDs. I think should be added to the primary health center. That's something that I missed.
Thank you, and I really please give them a big hand. I think we had an excellent panel, and just as I conclude, I think I'll just reinforce what was mentioned, three-stream approach, since many students and scientists are here. So what is the problem? Do we have a solution? And then do we have a political buy-in? So policy we can go to when we go through all these steps. So I request you all first help us define the problem better. And I think many of you are working on solutions, but make sure those are viable. And in terms of solution, one last thing I want to say, there has been a lot of talk on screening, and screening is not always a good thing. There are many clinical epidemiology guidelines on when to screen. When you have a solution, whether screening will really increase the longevity, whether screening will really reduce your chance of dying from that disease, whether you have a treatment for that. Because if you do too many tests, you will find too many things, you won't know what to do with that. So be careful, don't come up with solutions unless you really understand why we are doing it. Thank you very much again. Please feel free to talk to our panelists during the lunch break. Yeah. And please do come back for our next panel, which is going to be very exciting on senior care and communities. Thank you.
Yeah, thank you, the panelists and the moderator.